The very first bone of the free upper limb, and indeed the one located most proximally within this anatomical region, is the humerus, which is commonly known as the upper arm bone. This significant bone, the humerus, much like most other long bones found in the human body, is generally and systematically divided into three primary and distinct parts. Specifically, a robust proximal epiphysis, a corresponding distal epiphysis, and the elongated diaphysis, which is strategically located between these two ends. The proximal epiphysis and the distal epiphysis, both crucial components. The epiphyses are very rich in anatomical structures, whereas the diaphysis is less so, but it also contains some features. The most proximal part of the proximal epiphysis is the caput humeri, which faces medially. This caput humeri fits into the structure already mentioned on the scapula, specifically into the glenoid cavity, and together they form the shoulder joint, the articulatio humeri. Below the caput humeri and distal to it, there are two structures called tubercles. One of them, located more laterally, is the tuberculum majus, which is the larger tubercle, and on the anterior surface of the proximal epiphysis of the bone, there is a smaller tubercle, the tuberculum minus. So there is a laterally positioned tuberculum majus and a medially, well, not medially, but rather the prominent tuberculum minus, which is strategically located on the anterior surface of the humerus bone. Between these significant tubercles and the caput, or head, lies the crucial anatomical neck of the humerus, a distinct region, because it also possesses a separate surgical neck. This specific anatomical neck is formally designated as the column anatomicum. Furthermore, between the larger tuberculum majus and the smaller tuberculum minus, there exists another exceptionally important bony structure called the intertubercular sulcus, also known as the bicipital groove, which serves as a passageway for the long head of the biceps brachii tendon, sulcus intertubercularis. Important structures also pass through the sulcus intertubercularis, as we will see later. So the sulcus intertubercularis is located between the tuberculum majus and the tuberculum minus. Distal to the tubercles, roughly at the border between the diaphyses and the proximal epiphyses, is the structure called the surgical neck, or column chirurgicum. This surgical neck, and the reason it got its name, is that when someone falls on their upper limb, if the humerus breaks, it most often fractures in this area, since this is, in this sense, the weakest point of the bone, and this is where it tends to break. What we can also observe in this area are the continuations of the tubercles. Both the tuberculum majus and the tuberculum minus have distal extensions in the form of bony ridges. The bony ridges are generally called crests. There is a so-called crista tubercula majoris, which is the continuation of the tuberculum majus, and there is a crista tubercula minoris, which is the continuation of the tuberculum minus. These are roughly the structures you can find on the proximal epiphysis. If we look at the diaphysis, there is a structure here that serves as the attachment for a muscle, and this is the more laterally, and in theory, more proximally, the deltoid tuberosity should be located. This serves as the attachment for the deltoid muscle, and if we display the deltoid muscle, which is called the musculus deltoideus, you can see roughly where this structure should be situated on the humerus. As you can see, the deltoid muscle attaches in this area, and if I, instead of hiding it, just move it aside, you can then see that this is the area where the deltoid tuberosity, which serves as the attachment for the deltoid muscle, should be located. As you can also see, this structure is found on the posterior surface and shaft of the humerus, which the program does not indicate very well. For this, it is useful to display another structure, which is also a nerve, the radial nerve, because a structure corresponding to the radial nerve is found on the humerus, on the posterior surface of its shaft, and this is called the sulcus nervi radialis. This is exactly where it is located, where the radial nerve passes along the posterior surface of the humerus. This is the sulcus nervi radialis. You can see that this is a mediolateral structure, meaning it spirals from the medial direction toward the lateral direction on the humerus. Additionally, on certain specimens, you can also see a structure which we call the foramen nutritium. This can be translated as the nutrient foramen or something similar. The point is that this is the area where the blood vessels enter that actually nourish the bone, so we call it the foramen nutritium. There are no other structures on the diaphysis, but on the distal epiphysis, we can observe several structures. On one hand, the most characteristic structure of the distal epiphysis, which we collectively call condylus humeri. Here you can see the condylus humeri, and the condylus humeri can be divided into two smaller parts. One is the more laterally positioned capitulum humeri, which is the small head of the humerus, and the other is the more medially positioned trochlea humeri, which is a roughly horizontally oriented hourglass-shaped structure of the condyle. There are also structures located above the condyles, and in Latin, when something is situated above something else, we usually use the prefix epi, which is why these are called epicondyles. There is a smaller, more laterally positioned epicondyle called the epicondylus lateralis, and a larger, more medially positioned one called the epicondylus medialis. So there is a more lateral epicondylus lateralis, marked here in red and purple, and the larger, more medial epicondylus medialis. Beneath the epicondylus medialis, there is also a structure that is also serves as a crucial passageway for a significant nerve, specifically the anatomical groove known as the sulcus nervi ulnaris. And from this, you can deduce with certainty which crucial nerve passes through this specific anatomical pathway. It's also a significant branch of the larger brachial plexus, namely the ulnar nerve, a vital component of the peripheral nervous system. And you can see that it passes through that distinct anatomical area, clearly highlighted here in a vibrant green color, within the precise anatomical region of the sulcus nervi ulnaris, which is the distinct area strategically located directly beneath the prominent bony landmark known as the epicondylus medialis. Okay, and what else we can see here is that the epicondyles also have continuations, just as we saw with the tubercles at the proximal epiphysis. Here we also define these as bony ridges and we call them crests. The continuation or extension upward of the lateral epicondyle is called the crista supraepicondylaris lateralis, while the continuation or extension upward of the medial epicondyle is, in the proximal direction, that is the crista supraepicondylaris medialis. What else we can see on the distal epiphysis are grooves and fossae. Above the capitulum humeri, so this was the capitulum humeri, and here is the trochlea humeri. Above the capitulum humeri we find a groove, this is the fossa radialis, and above the trochlea humeri we can also find a groove, and this is the fossa coronoidea. So above the capitulum humeri is the fossa radialis, and above the trochlea humeri is the fossa coronoidea. There is another fossa as well, but that is located on the posterior surface of the distal epiphysis, and this is called the fossa olecrani. This structure is called the fossa olecrani because it accommodates a structure found on another bone, the ulna. As we will see, the ulna has a feature called the olecranon, and the olecranon of the ulna fits into the fossa olecrani located on the posterior surface of the distal epiphysis of the humerus.